Hello, my name is Logan Flood. Today I'll be discussing VA healthcare, including its challenges and potential opportunities for enhancement. As a nation, we owe a debt of gratitude to our veterans, and providing them with quality healthcare is a crucial part of honoring that commitment. Access to healthcare is not just a privilege, it is a necessity, particularly for individuals who have served in the United States Armed Forces. The Veterans Health Administration, or VHA, is entrusted with the responsibility of delivering comprehensive medical services to veterans. Despite its noble mission, the VA healthcare system has encountered substantial criticisms over the years, including delays, bureaucratic processes, and varying standards of care. Acknowledging these challenges represents the initial step toward meaningful reform. Some of the main challenges that the VA healthcare system faces include long wait times, legislative and budgetary constraints, as well as public misconceptions regarding the quality of care provided. These issues adversely affect all veterans who elect to utilize the benefits offered by the VA healthcare. Long wait times continue to be a significant challenge within VA healthcare. Veterans, on average, experience a waiting period of 22 days for primary care services and 42 days for specialized treatment, substantially longer than the typical 14 days for primary care services and 21 days for specialized treatment observed in the private healthcare sector. A prominent scandal in 2014 revealed that delays in care resulted in fatalities among at least 40 veterans. Since then, some advancements have been achieved, exemplified by an 11% reduction in wait times despite a rise in the number of patients. Nonetheless, further improvements remain imperative. The Department of Veterans Affairs operates within a notably challenging budgetary environment. Despite receiving 3.5% of the national budget, which ranks it as the fifth most expensive federal department, the demand for its services continues to escalate. In the fiscal year 2024, the budget experienced a 5.4% increase. However, the number of participants surged by 30%. While there have been positive legislative advancements, such as the expansion of education benefits and home loan programs, there remains a pressing need for more consistent funding to ensure the provision of adequate healthcare services. A significant barrier to improving the quality of VA healthcare is the misconception that its services are inferior. However, a study by the National Institute of Health has revealed that VA healthcare often matches or even surpasses that of private healthcare systems. Erroneous assertions undermine trust and discourage veterans from pursuing the necessary medical attention. Improved communication regarding the services available can help rectify these misunderstandings. In addition to general healthcare concerns, the VA encounters challenges in specialized domains such as mental health support, healthcare for women, treatment for substance abuse, and long-term care for elderly veterans. These areas are frequently neglected as they primarily impact only specific groups of veterans and not all of them. Mental health services are essential for veterans coping with post-traumatic stress disorder, or PTSD, depression, and anxiety. With a daily average of 21 veterans succumbing to suicide, the suicide rate among veterans is 50% higher than that of the general population, serving as a stark reminder of the mental health crisis afflicting the community. It is imperative to expand mental health programs and minimize wait times for these services, which should be a priority. Currently, women comprise approximately 20% of military personnel. However, the Department of Veterans Affairs has exhibited a sluggish response in adapting its services to address their distinct health care requirements. Matters such as reproductive health and trauma recovery necessitate gender-specific services. Women are diagnosed with post-traumatic stress disorder at a significantly higher rate than their male counterparts due to incidents of military sexual trauma, rendering mental health care even more imperative for women. Enhancing women's health care programs would guarantee that all veterans receive suitable and timely care. Substance abuse represents a significant concern. Veterans are more susceptible to issues of alcohol and drug dependency as a result of the stresses associated with military service and the challenges involved in reintegration into civilian life. Although the Department of Veterans Affairs provides effective rehabilitation programs, the availability of these services is frequently limited. Enhancing these programs and providing in-home treatment options could yield considerable benefits. As the population of veterans continues to age, the demand for long-term care services is experiencing a substantial increase. In 2024, a 14% rise in the number of veterans requiring long-term care was recorded. However, the current capacity of facilities is inadequate to meet this escalating demand. A nationwide expansion of long-term care services encompassing in-home care alternatives is essential to address this pressing issue. Rural veterans make up 25% of the total veteran population. However, only 13% reside within a 30-minute proximity to a Department of Veterans Affairs healthcare facility. In contrast, there are 82% of rural located veterans who live near non-VA healthcare facilities. This deficit in accessibility creates considerable barriers to the specialized care they qualify for. To rectify this situation, the VA should facilitate the expansion of outpatient clinics in rural regions and invest in mobile units as well as telehealth services. By enhancing accessibility to care for rural veterans, we can guarantee they receive the support and medical attention that they have rightfully earned through their service. In the year 2023, the number of homeless veterans reached 35,574, reflecting a 7.4% increase compared to the previous year, 2022. A significant portion of these veterans remains unaware of the various benefits available to them through the Department of Veterans Affairs. Moreover, many encounter considerable barriers such as the lack of transportation, which impede their ability to access necessary care. In order to effectively address this issue, it is imperative to expand outreach programs and to invest in mobile medical units that can deliver care directly to the areas where it is needed most. Every veteran is entitled to access the resources and support that they have rightfully earned through their service. In conclusion, it is imperative to recognize that the challenges confronting the Veterans Affairs healthcare system necessitate comprehensive reform. The expansion of services and enhanced outreach efforts. Veterans deserve timely and high-quality health care. Through comprehensive reform, the VA can effectively accomplish its mission of serving those who have honorably served our nation. Thank you.